Hi, it's Carl Lishing, independent insurance agent based out of Lakewood, Ohio. Today, we're going to talk a little bit about upcoming changes to Medicare as a result of the Inflation Reduction Act and how it's going to impact Medicare Part D for drug coverage. Medicare and Medicare supplements, Medicare Advantage plans, they've been fairly stable for some time now. We've got a little bit of a disruptor coming, I believe, but I think it's for the good. Now, let's talk a little bit about what this is. So in the year 2023, there was some legislation passed called the Inflation Reduction Act. Within it, there were components to strengthen Medicare Part D for prescription drug coverage, because there's been quite a few people struggling with prescription drug costs. Now, Medicare prescription drugs people can get it on what's called a standalone Medicare drug plan, or PDP, or through a Medicare Advantage plan with prescription drugs. On both sides of it, historically, Medicare Part D has had different coverage phases. So let's talk a little bit about that. If the plan had a deductible, there was the deductible phase. Not all do. Then people go into what's called the initial coverage phase, where they're paying copays for their medications. Now, behind the scenes, there's the full drug cost, the retail drug price. So let's say the member's copay is $5 to make this easy to understand, and the insurance company is paying $25 towards that drug. So if you take 25 plus 5, that's 30. That's the actual full cost. Once that full cost reaches $5,030 this year in 2024, then people go into what's called the coverage gap, or the donut hole, it's also referred to as. And when they get into the donut hole, they pay 25% of the drug cost until they graduate to what's called the catastrophic phase, if they get there. Most people don't. But the catastrophic phase, here's the way it works. What the members pay in the deductible, the initial coverage phase, and the 25% when they're in the coverage gap, those things combined, along with manufacturers' discounts when they're in the donut hole, and they can vary depending on the medication, but they can be up to 70% off. Those three things combined go towards what's called the true out-of-pocket. I believe that number's around $8,000. If they got there in years gone by, then the member would pay 5% of the drug cost. Now, 5% doesn't sound like a big number. However, if it's something expensive like an oral chemotherapy pill, that is $12,000 a month. Once they get into that catastrophic phase, 5% is still $600 every month. And there wasn't a maximum out of pocket on Medicare Part D in years gone by. So the Inflation Reduction Act says in the year 2024, which we're in now, that 5% coinsurance goes away. And then in 2025, Medicare Part D is going to have a $2,000 maximum out of pocket on it. So it will have a hard line maximum out of pocket, which it has never had before. Now, this is good, but it also costs money to do that. Now, Medicare Part D standalone drug plans receive government funding to run it. So do Medicare Advantage plans. Medicare Part D plans don't get as much money from the government to run it compared to Medicare Advantage plans that cover more things like healthcare expenses, things of that nature. So there's discussion right now, it's an ongoing debate as to what Medicare reimbursement rates are going to be. And it doesn't sound, from what I'm gathering, that the federal government is looking to increase what they're giving to the insurance companies to run Medicare Part D or Medicare Advantage. In fact, there's some discussion that it could be scaled back. But we don't know yet. This is all up in the air. So what's going to end up happening is if somebody has Medicare with a supplement and they buy their drug plans separately, the cost of those standalone drug plans is likely going to go up quite a bit. Some carriers got ahead of the curve and they started addressing those pricing increases, going from 23 to 24 plan design. Now, when insurance companies are working on their plan design and filing them with the Department of Insurance, they're doing that earlier in the year to get prepared for the annual enrollment season, which comes in the fall. It was anticipated that legislation was probably going to pass. So some companies filed for bigger rate increases on Medicare Part D plans going from 23 to 24. So some people saw their Medicare drug plans pricing go up a decent percentage. That's why is getting ready for this new and coverage requirements for Medicare Part D. Now on Medicare Advantage plans, the insurance companies get more money from the government to run it. So there's more funding coming in. In years gone by, they would put some of that funding into extra benefits to try to attract enrollment in members, like enhanced dental or vision, maybe the over-the-counter allowances, food card allowances, the Part B premium rebates that I talked about in another episode, to try to attract enrollment in members. Now, if the government funding for Medicare Advantage doesn't change much, they got to find the money from someplace to account for the cost of the increased coverage requirements for Medicare Part D. So each insurance company is going to have to make decisions on how they do that. Are they going to cut back in the extra benefits? Are they going to raise copays and maximum out of pockets, or a little bit here, a little bit there? They're going to have to make decisions. So I'm anticipating that going from the year 2024 to 25, we're going to see a little bit of volatility on Medicare Part D premiums or changes in Medicare Advantage plans. And then it will take a year or two for those coverage enhancements to settle in. And then the insurance companies will be tweaking over the next couple of years after they start seeing claims expenses coming in and how they need to adjust their benefits. So it's coming down the road. I just wanted to let you know about it on the upfront and provide this content. We'll be in touch more on this topic in the future for current clients as we approach the enrollment season. For people that are not current clients of ours, if they want to talk further and get ahead of the curve and prepare for open enrollment season, it's always best to get to know each other and talk about needs before we're in the thick of the annual enrollment period, which is October 15th to December 7th. At that time of the year, we're doing everything we can just to try to keep up with volume. So the planning phases and the getting to know each other, it's good to do that before enrollment season. So if you'd like to set up a time to discuss that, just call the office or click on the scheduling link on my website, and we'll have a conversation and start getting to know each other in advance. If there's questions, feel free to call. And again, thank you for your time today. Bye for now.